see that. Okay. See that when I start my presentation, I always begin with this one. Maybe you can read it.
Maybe.
And the topic of my presentation today is about Thailand-Towards, our health promotion program in preschool children. This is like a country program. You see, you can see that I'm from the Faculty of Dentistry, University of Payao, but before I worked with the university, I'm from the Ministry of Public Health in Thailand. And the presentation will be on oral health. You see that I think that most of us always think that maybe oral health is not like a serious problem because you work with many serious problems. But if you have like good oral health, you see that you can make life easier and better. You see that if you have good oral health, all the infectious disease will become less, and especially in the IDP children. You see that this is like a percentage of children age 12 with dental caries by years and region. You see that in Thailand we have like national oral health survey. I mean national oral health, that means the whole country. You see that we have national oral health survey every 5 years. Every 5 years, you see, for the country. From 1984 we have going up, yeah. But for the urban areas, the dental caries in urban area is going down. But for the rural area, it is going up. And this is the percentage of the children with the dental caries with age group. You can see this is 3 years old, 3 years old is here, this is 5 to 6 years old, this is 12 years old. But maybe we will concentrate on the 5 to 6 years old. You see that since 1984, the increasing of dental caries by age is going up. You see, since 2001. Yeah. This is something that it's going up. You see that we recognize, we try to have some program since 1984, and then I can show you that what kind of program that we have. When we see the increasing in this age group, we try to have many programs. You see, like we have oral health education in ANC and in the baby clinic. We have like program, my first toothbrush program, that try to have the children start to brush at 1.5. We have like fluoride supplement, and this is all of this program. We have like quite a very good coverage for the whole country. But you see that after 5 years, the dental caries is still going up. So every 5 years we have the evaluation, and then we change the program. We have like still have like oral education in ANC and well baby. We try to have many kinds of fluoride drop and tablets, and also we try to have like community fluoridation also. But you see that after implementation, and this is some program that we try to have to teach every mother to have very good brushing program. And you see that the oral health personnel, we work very hard to reduce the dental caries in the small children. But you see that after that, it's still going up. If you're going up, I think that now we have to rethink what is the cause of this one. If you can see, can you see what is in this bottle? You see, and this is grandma, this is not ma, this is grandma, yeah, and this is something, that's soft drink. You see it's in red, and then they put it. You see, if the children do like this, all the front teeth will disappear. You see, will disappear with the dental caries, you see, at a very young age. And mother, you see that they doesn't have time to take care of children, so most of them take their kids to the daycare center. They don't have much time. This is something that happened in Thailand that they don't have time to take care of their own children. They have to work during the day. Maybe at 1.5 months old, they take the children to daycare centers and leave them over there. And you see, this is everywhere in the rural area of Thailand. In the rural, you can find these two little girls. She's wearing pajama. This is what they have before they go to bed. What happened with their teeth, you see? And you see, what is this? This is some kind of soft drink that you can find it everywhere. And this is just in front of the school. You see, very colorful and very dangerous to your teeth and also to your health. And this is something that in front of the school. And this is also in front, very common in front of the school. And this is an increasing trend of the sugar consumption in Thailand. You see that since this year is going up to 29.1 kilogram per person. This is the to consume a lot of soft drink, a lot of sugar. And this is something that's in the adult that cause the oral health problem. You see the smoking, drinking, and also like oral health lesions in the. What is the cause? So if you go into the population, we have oral diseases here, and I think that if you look at individual, you see that you can find a lot of junk food, carbonated soft drink. You have high sugar intake. We have alcohol and tobacco consumption. We have poor personal hygiene. And this is at individual level. If you look at the community level, what is it? A family pattern that mother doesn't have time. And we have widespread of unhealthy food and alcohol and tobaccos everywhere, even in the village, very far. We have value and attitudes. This is at the community level. But if you're looking up, what is the cause? The social, globalization of market, the development, the transportation, media, and program advertising. This is like the root cause of the oral diseases. In this context, I think this is beyond dentist capacity. You see, this is beyond dentist capacity, but the community themselves have power to do something. You see, we need the power of the community. You see, we need social action for health. You see that it doesn't mean that mother does have knowledge. They know very well that sugar and sweet is not healthy for their children. They know that. And we try to motivate them and we try to give them skills how to brush, but it is not work. You see, we want something, we want enabling environment. And then if it's possible, they will act. I show you in detail of this one. You see, this is the percentage of children 5 to 6 with dental caries. We try to have like community-based program. We empower mothers groups. You see, this is some activities of the mothers group. You see that children in the rural area, sometimes the mother doesn't have time to cook for them, and then they always running to the grocery shop in front of their village and buy something to eat, and then that's it. They don't know. They don't want to eat rice main meals, and mother doesn't know how to cook. And then after they realize what is the cause of dental caries and the cause, and then they try to organize something. You see, this is a group of mothers that they try to cook for the children and try to have the children sitting together and try to have them like have a lot of vegetable and fruit. And this is something of that they have the dental educations by mothers group. Mothers group can do something. And this is the community with high caries rate in preschool children. What is the initiations of mothers group? Women's core group disseminate information about benefits of vegetable consumption on oral health. Women's core group negotiate with the grocery store in the village to sell non-sweetened milk. Women's core group negotiate with the grocery store to move the industrialized product, packaged food, to the upper shelf. You see that the children cannot pick it by themselves. Mother have to do it. You see, and women's core group organize a cooking class to new mothers. This is something that initiated by the mothers group when we working with them. And this is another program that they try to promote the vegetable. You see that this is happened in a very, very poor village in the northeast of Thailand. You see that children have only 1 baht to go to school. At 1 baht, you cannot buy anything. You see that only, only toffee, yeah? And sweet things, 1 baht. And then this is something that mothers group try to do it. You see that they grow the vegetable and they bring vegetable to schools and then cook the healthy food for the children to have. They have their main meal filled, yeah. And how can we have the mothers to do something like this, to create something new like this? You see that we go to work with them. Most of the dentists stay in the room, you see, in a very small square room. Never go to the village to see what is the real cause of that problem. So we go to work with them and then assist them to assess the problems. You see that sometimes they see that their children have like dental caries, but if someone don't tell them, they just let it go, or it's quite not a serious problem, it will gone, and its affect their children's health. We try to assist to assess the problem. You see, and then we empower them that they can decide on whenever they know, whenever they ever concerned about this problem, they can do something. You see, they decide on, plan for, and execute their action. You see, if it come from their initiation, they can do it right away. You see, they don't have to wait for any person to do. And we can conclude, what can we do? We can call it identify community problem. We can call it evidence-based surveillance. And for the evidence, we can present the problem to the relevance group, and then we try to have like appropriate social technology to empower the mother group, and then we facilitate the community action in solving the problem. You see, once we empower them, they can think and they can create with their own, and then this is the loop that I would like. At the macro level, you see that's a micro level, and also at the macro level, we also try to require the conducive health policies and supportive legislative and regulation. You see that this is something that we can do for it. Sugar-free follow-on formula. You see that now in the old time, the follow-on formula milk, they add sugar in it. But after something, we try to have the regulation that there's no sugar in the follow-on milk, and then we can ban on carbonated soft drink in schools. You see, this is after we implement the Sweet Enough campaign. We have something that Sweet Enough campaign. We have the ministerial regulation to prohibit sugar addition in follow-on formula milk. You see that we tried to introduce this in I think it's in 2000, about 2005, that we introduced this program. After 2005, the follow-on formula, there's no sugar in it. You see, and how we advocate. You see, we advocate the policies maker and also the public, and we work as a partnerships. If we work as a partnership, you see that we have synchrony of effort and synergy of effects, you see, and then I try, yeah. And the key success factors of this is be part of general health promotion. You see that if you speak about oral health, it's nothing. You see, it's not a serious problem. But if you integrate it with the general health, the non-communicable disease, they share the same risk factors. It share the same common risk factors. You see, if tobaccos, it share common risk with cancer, with respiratory disease, with diabetes, and also periodontitis. And diet also with the cancer, with CVD, with obesities, and with dental caries and dental erosion. You see, this is share common risk factors. So we try to work with them to integrate with the non-communicable disease. And also we try to build a partnership. This is something that I show you the examples of how we build the partnership in Sweet Enough campaign network. You see that the Thai eat a lot of sugar, and then we have this if it in Thai I call it in Thai that's เด็กไทยไม่กินหวาน you see the Thai ไม่กินหวาน but in English we call it Sweet Enough campaign network. The network begin with like dentist, pediatrician and nutritionist because all of this profession they concerned about eating too much sugar, you see, and then dentist form network and nutrition form network and pediatrician form their network, and also we working together. And also finally we have like school network that working together, private sectors also come, and family network also joined us. So this is like building a partnership. And this is some pictures at the kick-off of the campaign in 2002. We have nutritionists, we have pediatrician, we have dentists that starting this program together as a networking. You see, and in 2005, we have like working with the Ministry of Public Health that we are try to have it. You see, since 2005, we have the ministerial regulation. So we can reduce 40 to 80% from to 19% in 2007. That's the consumption of sweet milk. We can reduce a lot, you see, after this regulation. And we have like a ban on carbonated soft drink in schools in 2007 and 2008. That carbonated soft drink is available only less than 30% in primary schools, and children who studies in school carbonated soft drink 5 to 7 times. And sugar, you see that carbonated soft drink, a lot of sugar in it, yeah? And very low pH that not good for your teeth. Yeah? And also we have like campaign on snack labeling with the nutrition labeling. Yeah, that's this is the energy, this is sugar, this is fat, and this is sodium. You see that if we work with non-communicable disease, high fat, high sodium, high sugar is all the risk factors. So we included with them. So we have like snack labeling. And then we also restriction on television advertisement. We have many things to control the time, to control the contents of the advertisement in the television. Yeah? And this is our main strategy, which we can call it health promotion. Let me remind you of the what is health promotion. The promotion is the process of enabling people to increase control over their health and its determinants and thereby improve their health. It moves beyond a focus on individual behavior towards the wide range of social and environmental intervention. This comes from Bangkok Charters. And this is adding something. You see that the dentists, as most you know, they are like working in the clinic. But this is something that we try to have new dentists, that we have social dentistry. You see the competence of the teamwork. That's on top of the technical skills of the dentist. They might have like communication skills, advocacy skills, leadership skills, coordination skills, and belief in power of humanities and warm and sincere personalities. And also we have to have like partnership building and social mobilization skills. Okay, thank you for your attention.